Thanks for following my Resilience on Draft newsletter. I get a lot of questions about stress management and breathing and meditation. And meditation can be really intimidating because it's kind of hard to do. It's hard to slow your brain down. It's hard to focus on we think we have to focus on nothing. We have to clear our mind, and it has to be a blank slate while we're meditating, which is almost impossible because our brains are always on, engaged, neurons firing. You're thinking about so many different things. So I'm going to give you a really, really simple technique called belly breathing. It's my favorite technique. And the reason I'm going to talk about it is because about 4 years ago, I had a lot of shoulder issues. I was really tight in my traps. I was getting headaches because my neck was really tight. And I knew that my posture wasn't great. And I went to a physical therapist, and the first thing she had me work on was belly breathing. And doesn't that seem really odd? I was like, no, but I need you to fix my shoulder and fix my trap. And she was like, I understand that, but you are chest breathing. Most of the day, you're breathing through your chest. And so all of your chest muscles, your traps, your lats, even your intercostal muscles, those muscles are your tertiary muscles for breathing. And for you, they're your primary. So those are what you're using most often. And they're getting really, really tight. And because I can't even really chest breathe anymore, if you're breathing like that a lot, this gets really tight. Your shoulders start to elevate and round forward. No wonder I was in pain in my shoulders, right? I was lifted, I was rounded, and I was breathing through my chest. So I say that because maybe you have the same sort of issues in your traps and your shoulders, and belly breathing could be really a great option. And secondly, when we're breathing through our chest, it's not relaxing. Usually it's sparking a our fight or flight system of our nervous system. When we're breathing through our belly, it's the opposite. It's that rest and digest. It's stimulating the relaxation hormones. So usually at night, if I have trouble going to sleep, I start to belly breathe, and it usually only takes 5 to 10 breaths, and I'm passed out. So if you're not used to belly breathing, it might take a little bit longer for you, but I definitely recommend trying it. So I'm going to show you the way that it looks from the side. So usually when I was first trying to figure out what to do, I would place my right hand on my chest and my left hand on my belly, and I would try to breathe so that my left hand was the only hand moving. So I'll try it right here. So hopefully you can see that my left hand was moving. My right hand was moving a little bit, but certainly not as much as my bottom hand. So I was breathing into the belly. And if you're not used to it, like I said, it is hard. You will feel kind of tight because those muscles, if they're not utilized, they do get tight. They kind of get quiet. So you might feel some tightness in your diaphragm or in your ribs. So another really good tool is to bring your hands to the outside of your ribs and try to get your hands to separate away from one another, so you're breathing into your ribs. So belly breathing and even wide rib breathing is a really great tool to slow down, to relax your body, to relax your mind, and you're distracted really with the breathing. So in a way, it definitely is meditation because you're focusing on your breath, and thereby not focusing on all the other things going on. So let me know how it goes. Good luck and get to belly breathing.